It's Wellness Wednesday, and it's also Heart Month, so we're going to learn more about some technology to help you learn more about your heart health. Joining me today, Dr. Nicole Nelson. She's Medical Director of Radiology at Mercy Health St. Rita, so thanks for coming today.
Thanks for having me, Holly.
Okay, so we're going to talk about a CT heart flow. So what is that? How does that work? What's it have to do with your heart?
So there is newer technology where now we can image the heart, specifically the coronary arteries, with a CT scan. So with just an IV in someone's arm, on the CT scan table, so you don't have to have a catheter in your groin to image those arteries.
Okay, all right. And so the benefits would be what?
So it's really geared for people that are low to moderate risk. So if you're high risk, you should definitely be with a cardiologist getting a traditional cardiac catheterization. But for people who kind of, maybe they had an abnormal stress test, but we really think they probably don't have cardiac disease, this is a great test for them.
All right, so can it tell stuff like you've got a clogged artery somewhere or your arteries aren't working right? I mean, what does it show you to be able to help us out for our heart health?
Yeah, absolutely. It shows us both the inside and the outside of the coronary arteries, the arteries that feed the heart muscle, which is what pumps and fuels our body. The other technology that we've added in the past year is something called heart flow. And this is using, the buzzword, it's using AI technology to actually calculate how the heart muscle is extracting the blood to see, even if there is a mild stenosis, does it really make a difference, right? You can have a mild stenosis and it doesn't affect the function of the heart, but if there's a significant stenosis and it's affecting the function, that's really important for your doctor to know.
Right, yeah, so you read it and you say, oh, there's a problem here. So then you go to the heart doctor and take it from there? I mean, is that how the flow of this goes?
Exactly, so whoever ordered the test, they would probably refer you to a cardiologist, or if it's completely normal, then you can still be managed by your primary care provider.
So you mentioned a cardiologist and a doctor order. So do you have to have the doctor's order for this kind of test?
You do have to have a doctor's order for this kind of test, because it's important that your health care is managed by a physician or whoever your primary care provider is. We have lots of physician extenders now.
All right, so it's just they say get one, and it's just kind of like schedule the appointment and you go from there, right?
Yeah, and it's important to speak with your provider if it's appropriate for you. So who is this test appropriate for? Family history of heart disease? Absolutely. High cholesterol, kind of chronically high cholesterol, but is asymptomatic. Something you want to talk to your doctor about, because something else that can be done is a calcium score, just a calcium screen. That's non-contrast, quick and easy. You don't even have to get an IV for that one. It just lets someone know you do have early heart disease, even though you're asymptomatic, because as with all medical conditions, it's best for us to treat you before you have symptoms.
Right, yeah, and with your heart health, we're focusing on that this month, and it's nice to know there are all these different tools that are coming to us to be able to prevent, hopefully, that heart attack or something worse, right?
Absolutely, because heart disease is the #1 killer globally and in the United States for both men and women. So it's really something important to think about for your own health.
Right, all right, a CT heart flow. Well, thanks for coming today. Good to see you.
Thanks for having me.
All right, don't go away. First Edition continues in a moment.